Well, good morning, everyone. I'm here in place of Mandy Andrews, as she's double booked. So I'm delighted to be able to be here this morning and bright and early. So it gives me great pleasure to introduce the speakers today. And just bear with me till I get into my... Okay. So integrated care, intermediate care. Our first speaker today is Annerieke Stoop. And I won't say anything else about Annerieke, and the speakers will introduce themselves, but I'll just be the timekeeper. And if you see me standing up, your 15 minutes are just nearly there. So welcome, Annerieke.
Okay. Yeah.
And we'll keep questions to the end, if that's okay.
Can I just do this? Yeah, perfect. Okay. Yeah, I think it's working. Well, good morning, everybody, on this very early morning. I'm happy that we have some audience this morning, so thank you for coming. My name is Annerieke. I'm a PhD student at the National Institute for Public Health and the Environment and the University Medical Center in Amsterdam in the Netherlands. Today I would like to tell you something about the outcomes of the SUSTAIN project. The SUSTAIN project is a project about a cross-European research project about improving integrated care for older people living in Europe. And today I would like to present the overall outcomes, and everything that I am explaining this morning can also be found in the overarching policy report, which can be found on the SUSTAIN website. Well, first of all, I would like to explain a little bit about what the SUSTAIN project actually is. So, in the SUSTAIN project, we aim to improve, establish integrated care initiatives for older people living in Europe, and we also would like to monitor and evaluate these improvement processes. And on the other hand, we would also like to contribute to the adoption and application of these improvements to other health systems and regions in Europe and abroad. Well, in the SUSTAIN project, we focus on 5 key domains, which means that we actually want to improve 5 domains of health and social care delivery. So we want to make care and support more person-centered, prevention-oriented, safe, efficient, and coordinated. Well, in all these initiatives focus on older people with multiple health and social care needs. And the initiatives that participate in the SUSTAIN project are located in 7 different countries, which are Norway, Estonia, the United Kingdom, the Netherlands, Germany, Austria, and Spain. And all these different initiatives are very different from each other, so they have a different target group. Some focus on very frail older people or people with dementia, and others are more focused on older people with some needs but not too frail. And we have different initiatives. They provide different types of care and support. So some are delivering dementia care, some are providing proactive primary care, some are focusing on transitional care, which means transfers between hospitals and home. And we also involved rehabilitative care and home care services. And in all these initiatives, they want to improve the current ways of working. And they all, in all these initiatives, they implemented improvement processes. And I will explain what we've done throughout the SUSTAIN project. So we had a participatory approach in which we collaborate with local stakeholders from these 13 initiatives. And to have this participatory approach, we first started to have working relationships with local stakeholders from the initiatives. So we started to getting to know each other, and we have interviews and sessions with them in which we want to know about our integrated care initiatives. So what are the characteristics of the initiatives, but also what are the challenges and barriers that they perceive towards integrated care. Then we have workshops in which we, together with the local stakeholders, identified potential improvement areas. And we designed actual improvement projects in which they state what they would like to improve in what time frame, etc. Then these improvement projects were rolled out by the local stakeholders from the initiatives. And the improvement processes were monitored and assessed. And we provided feedback to the local initiatives about how they were doing, about the progress and the outcomes already during the implementation of the improvement projects, to give them feedback and for them to be able to refine their improvement projects. And to analyze the improvement project, we adopted a multiple embedded case study design, which means that all individual initiatives were perceived as an individual case study. And to build a case study for each site, we have different ways of data collection. So we have interviews with users, interviews with managers and professionals, interviews with informal carers, but also focus groups. We did surveys, we had observatory data, so we have all different kinds of data that we collected. And all data for each site were analyzed. And as such, we were able to build an individual case, and that we're able to do a kind of site-specific analysis. And the outcomes of the site-specific analysis were compared and integrated to be able to make an overarching analysis in which we compared and integrated all lessons and experience from the different sites. And today I would like to focus on the outcomes of the overarching analysis, so in which all experience from all sites were compared. So first I would like to explain a little bit about the improvement projects. We saw that among the 13 initiatives, the things that they would like to improve were different from each other because local stakeholders decided themselves what they would like to improve. But we also saw commonalities between the improvement projects. So some sites were focusing on improving collaboration, communication, coordination between health and social care professionals and organizations involved. So getting to know each other and also understanding each other's roles and responsibilities. On the other hand, we have also projects that focused on improving the actual care delivering processes. So for example, making the care process more person-centered. Well, what kind of integrated care activities were part of the improvement projects? We saw that despite that the improvement projects had some similarities, we saw that every initiative had its own unique combination of actions and activities in the improvement projects, but we saw that the initiatives undertook activities in similar areas. So for example, in most of the sites, they conducted new ways of doing needs assessment and developing care plans, for example, by involving older people and their informal caregivers and discussing their needs and preferences. But we have also activities that were really site-specific. For example, in the Austrian site, there was staff training to professionals from the hospital about early detection of dementia of people admitted to the hospital, and that was only taking place in the site in Austria. So we made a difference between site-specific activities and more generic activities. And most of the activities were addressing person-centeredness, and less activities were focusing on safety and efficiency. But in the end, actually, most activities addressed several key domains at the same time. So for example, in one of the sites, they were changing the location of rehabilitative services from institutions to homes. And with that, they hoped that people feel more comfortable, and also the advice was based on their own situation, and they hoped that services were more person-centeredness, and simultaneously they also hoped that by avoiding unnecessary transfers between hospitals and home, they also make care more efficient. So they were addressing several challenges at the same time. So what seems to work then? Well, actually, we saw that the majority of the activities were able to improve person-centeredness, prevention orientation, safety, efficiency, and coordination. So for example, in one of the improvement projects in which they would like to make people more comfortable living at home and enable independent living, people really indicated that they feel more comfortable to live at home and they feel more safe to live at home. But on the other hand, we also saw some activities that did not work out as they hoped, as they intended, or activities did not work for particular groups of older people. So, for example, in one of the sites, they have activities about empowerment and involvement of frail older people, and it turned out that it was too much for this frail population, and they were not able to be involved as professionals and managers hoped that they were. And on the other hand, we also saw some discrepancy between the views of managers and professionals and between the views of users and carers. So professionals and managers were often more positive about the outcomes of the improvement project. So, for example, they found that involving other people in the care planning process, that was very positive and it improved person-centeredness. But we also have interviews with some users and informal carers in which they indicate, well, actually, I'm not involved at all, or they only talk with my informal caregiver and they don't talk with me. So there was still some discrepancy, and it was very interesting to see that professionals and managers do perceive improvement different than users and informal carers. We also saw that the evidence on improving person-centeredness was more available than improving safety and efficiency. And this was because there were more activities on improving person-centeredness and there were less activities on safety and efficiency. But on the other hand, we also saw that the managers and professionals from the sites indicated that the limited time frame of the SUSTAIN project, which was only 12 months of implementation of the improvement projects, that it was too short to be able to notice any differences. So, and why did some things work or did not work? Well, we saw that some of the explanations for succeeding or for not succeeding were related to the characteristic of the integrated care activity. As I explained, some activities are not suitable or not appropriate for the most frail population. But on the other hand, we also saw that some explanations were related to the context in which the activity was implemented, and we distinguished three different levels of the health and social care system, which were explanations for succeeding or for not succeeding. So we had the micro level, the meso level, and the macro level. And on the micro level, we saw that the motivation and the commitment of the professionals who were actually implementing the improvement projects, that was a very important reason for succeeding or for not succeeding. On the meso level, the presence or the not presence of leadership and ownership of some leaders was an important point for succeeding or for not succeeding, and also if there were available, if there were resources and time available for professionals to actually implement the improvement projects. And on the macro level, we saw that there were some national and regional policy and legislations which helped or hindered the implementation of improvement projects. So overall, we saw that there were the factors that explained success or not success of the improvement project were quite generic and were observed in most initiatives, but we also saw some factors that were site-specific. So for example, in one of the countries, we saw that the professionals did not have a very positive attitude towards older people, and for them it was very hard to involve older people in the care team and as being part of the care process. And we also saw some political, historical context. So in one country we saw that it was hard for older people to be involved because they were not used to raise their voice or they were not used to give their opinion about things, and it makes it harder for them to also be involved in expressing their care needs and preferences in developing a care plan. Well, we also have in the overarching policy report that we prepared, we also made some recommendations to improve integrated care. And we made some recommendations for policymakers, for service providers, and for the research community. And I would really like to encourage you to read the overarching policy report, to read all recommendations, but I will just mention one for each of them. So for the policymakers, we would like to encourage to have dedicated funding for integrated care. So from many sides, they indicated that funding levels were not sufficient, they were unstable and not sustainable, and there were also financial barriers to work together between the healthcare sector and the social care sector, or between the primary care and secondary care. And to have funding systems that are appropriate for integrated care, we might overcome such barriers. For service providers, we would like to recommend that the starting point of improving integrated care is first to identify what is important for older people themselves, what matters to them. And they are older people, and our informal carers are important actors in integrated care, not only in their own care process, but also in the larger processes of improving services. And to have interprofessional collaboration, it is important to first get to know each other, to know who the other professionals are, to know each other's roles and responsibilities, and really invest time in knowing who is also working with older people in your community or in the area that you're working in. And for the researchers, we would like to suggest to consider alternative study design. In the SUSTAIN project, we used the multiple embedded case study design to evaluate and monitor improvements in integrated care. And we all know that it is hard to evaluate integrated care. And we also know that traditional ways of doing research, like the RCTs, are not always feasible for evaluating integrated care. And alternatives like the realist evaluation and case study design may also be a good way of evaluating integrated care. Well, thanks for your attention. For more information, just contact me or visit the SUSTAIN website, in which all things about the SUSTAIN project can be found. Thanks.